Good evening everyone, and thank you for joining me for my video presentation. My name is Maria Gonzalez. Today I am going to be talking to you about human sexuality, specifically about something we all know about but we all hope to never get, STDs. HPV, also known as human papillomavirus, is one of the most common STDs around the world. It is a viral infection. There are over 100 different strains of HPV, some of these which can cause genital warts or even certain types of cancer. Some of the different types of cancers that HPV can cause are cancers of the genital area, such as the penis, the vagina, as well as the anus. It can also cause cancer on your mouth, your throat, as well as your upper respiratory tract. So since HPV is a sexually transmitted disease, it is transmitted by sexual intercourse. This viral infection is also transmitted by skin-to-skin contact. So you don't necessarily have to have any sexual intercourse. It can be transmitted simply from the skin of one partner touching the other person's skin. So how might one know if they have HPV or not? The tricky thing about HPV is that it doesn't necessarily come with any symptoms. The only way that one might know if they have HPV is if they do develop genital warts, either around the labia, the vagina, inside the vagina, or in the cervix. And for men, it could be on their penis or around their anus, as well as for women. For women too, though, there is another way that they can test for it, which would be in their annual pap smear. They have the ability to even test exactly what strain of HPV one might be infected with. Sadly for the guys, there is currently no known method for testing for HPV. It is something that is probably still in the works. However, there is an anal pap. The anal pap can be used to test to see if you are infected with HPV around your anus. So what treatment exactly is offered for patients that do end up being diagnosed with human papillomavirus? A lot of the different strains of HPV don't require any treatment. It can take up to 2 years for your body to completely get rid of the virus and without needing any additional treatment. 2 HPV strains that might require additional treatment are 6 and 11, which are the ones that are responsible for most cases of genital warts. These genital warts can be either frozen off with cryotherapy, or your medical provider can prescribe you medication to get rid of the warts. Getting rid of the warts helps prevent further outbreaks in the future. Other strains of HPV that might require additional treatment are the strains that are cancer-causing, which are 31, 33, 45, 52, 58, as well as 16 and 18. If a pap smear comes back positive for one of these types of HPV infections, there might be a need for a follow-up appointment in order to complete a colposcopy. This removes a amount of cells from the cervix or inside the vagina to further test there are no cancerous changes in the tissue. If anything does come back positive for cancerous cells that are caused by one of the HPV strains, the provider at that point would follow through with a plan to treat the cancer itself. The only question left to answer is, how do you prevent being infected or contracting HPV? This might be a little difficult if you do not have any immunity to the human papillomavirus. Luckily, there is a vaccine, Gardasil 9, which does protect against a lot of these dangerous strains of HPV. The vaccine can be administered as early as 9 years old and up to 12 years old. The younger that the child is, the better immunity they build against all these strains of HPV. However, in recent guidelines, it has been extended. It used to be that the vaccine could only be received up to 26 years old. However, it has now been extended up to 45 years old for men as well as women. Well, it has come to the end of my presentation. I want to thank you for visiting with me and letting me present this important information to you. If you have any further questions, please feel free to contact me or reach out to me, and I'll answer them as best as I can. Thank you.